This is Emily Pierre,
Rachel Miller,
and Nick Thompson.
And this is our community assessment, and we will be reporting on Ramsey County, Minnesota.
Now, Ramsey County makes up one of 87 counties of the great state of Minnesota. And we first begin talking about determinants of health summary. And the last census taking was in 2015 that recorded the population being 538,133 people. Of this county, there's a great diversity of race, white population making up the majority, with the Asian population second, followed closely by the African American population coming in at third. Between this population, the greatest is from the ages of 25 to 34. This population as a whole is projected to grow greatly by 2035, especially in the population dealing with the elderly. We'll now look at in the section health behavior summaries. We can begin looking at the median income, which is $57,384, which is a bit low the state average. We also want to look at that the individual poverty level is roughly 16.5%, which is higher than the state average. It's also important to note that the graduation rate of 2016 on time was 73.6%, which is below the Healthy People 2020 goal. Dealing back to the diversity of this county, there's also many languages. The most common is English, with the second most dealing with the Asian population is Hmong. When it comes to lifestyle patterns and housing units, roughly 60% are owned houses. Also, I begin to note that the health literacy, this may become as a surprise, but per capita of any county in the state, Ramsey County is highest in chlamydia and second highest in HIV. Now looking at section 3, look at the physical environment summary. It's important to note that this county is both urban and rural, but predominantly urban and growing more and more. Also important to note the number of days air quality as good was 291 in 2016. And regarding transportation, 73.2% of them drive alone to work, which is an average commute of 22.6 minutes to and from.
There are two pieces of the social environment we think are worth noting. First, almost 50% of Ramsey County claims to not abide by any one religion or faith. 24.5% of the community associates with the Catholic denomination. The second social environment are the support systems and social services. This is one area of strength for Ramsey County. Ramsey County has a police department that offers community support services, contract law enforcement services, investigative services, K-9 unit, patrol services, unsolved case services, and water patrol services. Some of the law enforcement services partner with various programs within the county, such as Neighborhood Watch, Night to Unite, and prevention tips at community gatherings. Access to health services, or what Carolyn Garcia calls in her book, Population-Based Public Health Clinical Manual, the Henry Street Model for Nurses, the 7 A's of Access. For the purpose of this presentation, we will focus on just 2 of the 7 A's. One of the 7 A's states, how appropriate are the services for the individual, family, and population? Ramsey County offers an array of community support and social services at the level of the individual, family, and the entire population, which include adult protection, disability services, mental and chemical health services, child protection, children's mental health services, truancy and runaway intervention, foster care, child care licensing, adoption services, and chemical health services. Another bullet point of the 7 A's states, Are services available and convenient for the individual, family, or population in terms of time, location, and place for use? Ramsey County has several hospitals and clinics. When looking at the yellow pages under hospitals in Ramsey County, there are 306 listings. The services offered are from urgent level 1 trauma care to radiology or urology care and are for both the adult and pediatric patient. These hospitals range from public, private, nonprofit, or for-profit institutions and are located in the city of St. Paul, such as Health East St. Joseph's Hospital in downtown, or in the suburbs like Health East St. John's Hospital. There's also specialty hospitals like Health East Bethesda Hospital located in St. Paul, who has an acute complex respiratory care unit and a wound clinic.
Part 2 of the Community Assessment and Data Analysis. Section 1 includes the health statistics and summary. For the top 10 communicable diseases and rates, specific rates were not able to be found. However, the top 10 communicable diseases include antibiotic-resistant infections, Lyme disease, human anemoplasmosis, HIV and AIDS, chlamydia, gonorrhea, syphilis, pertussis, tuberculosis, and foodborne illnesses. For the top 10 non-communicable diseases, specific rates were not able to be found. However, the diseases include Alzheimer's disease, arthritis, asthma, cancer, COPD, diabetes, heart disease, stroke, obesity, and mental illness. Some of the health risk behaviors we found for Ramsey County were unsafe driving habits, self-inflicted and unintentional drug poisoning, suicidal thinking, and self-injury due to cultural, social, and psychological factors, youth violence, smoking and alcohol use, and early sexual activity. After completing the community assessment, we believe it should be noted that Minnesota is ranked 5th healthiest state out of the 50 states. In our opinion, this is a good rating and a strength of the community. However, Ramsey County also had the highest number of adults in the metro rating their health as fair or poor. With that being said, some of Ramsey County's health concerns are sexually transmitted diseases. This is evident by Ramsey County failing to reach its Healthy People 2020 goal for condom use. Identifying community health priorities and establishing goals. Our first goal is to decrease the rate of STDs in Ramsey County by meeting the Healthy People 2020 goal on condom use. The first goal to decrease STDs is by targeting this health issue at the primary level of prevention, beginning with education in middle and high school health classes on the diseases themselves and how to prevent them, such as abstinence and/or the use of protection. In addition, nurses can hold educational classes targeted towards parents of middle and high school students on how to educate their children and promote healthy communication regarding this issue. These classes will be held at venues such as schools, churches, and health clinics. This slide includes all of our references used for this research assessment.